Dr. Zhao tells story about his treatment. Dr. Zhao killed an 1-year-old boy who had a kidney infection caused by one-side ureter blockage. Hello everybody. Today I'm going to tell you another story. I have treated a boy. He keeping have a kidney infections and only 1 year old. So after I give some treatment, he was cured. So one day, his mom called me, said, Dr. Zhao, can you do anything to my boy? My boy is only 1 year old and he's keeping have the kidney infections. So the doctor investigated, found one tube which is from the kidney to bladder called the ureter and blocked. So they are going to put a tube through the urethra to the bladder and then go into the tubes which is carry the urine from the kidney to bladder, and then try to open it and ask me if I can do something let the boy avoid the operation. So I said I can try. So that's the theory. So I said to her, and the Chinese medicine think or thought, so the low back is the kidney's controlled area, or we call it the house of the kidney, or the palace of the kidney. So, and because the boy's mom is my regular client, and she's trusted me very well, and she regularly comes to me for some treatment. And she had a twin, and 1 year ago, one is a girl, one is a boy. And when she bring the boy here in, and I checked the boy, and I asked, I said, can the boy walk or can the boy stand? And the mom said, the girls can, but the boy seems very slow, and he cannot, or he doesn't like stand for long, or also he doesn't like to walk. I said it's interesting because the low back sometimes controls the legs. So the Chinese medicine also said the kidney controls the legs. So that's interesting. So I said, okay, let me check. And when I touch the low back, the boy started crying. Said, try to avoid to touch the low back. Of course, the low back spine from the, I even tried to, from the thorax, lower thorax from the 12, 11 downwards, because that's all the kidney area. And later I will show you on the chart, show you how the nerves from the low back, from the sacrum ilium area control the kidney and urine tract, or I said the urine tubes, carry the urine from the kidney to bladder. And then I did, the mom cooperated with me, and I explained to her what's the reason. So I did a massage and rubbing and pushing on the low back. And surprisingly, after a few days, the boy started walking and also no more urine infection. Also, I asked the mom, I said, you can bring the boy in, I do another few treatments. Altogether, no more than 3 treatments, and the boy was cured, and no longer needed the operation. So I'm very happy to tell you about this story, and also gives the medical world a little bit ideas. So if the chronic kidney infection, and that could be low back nerves blocked. So also I treated many other lady with chronic blood infection or urine infection, and just treat the low back, and the infection can be cured very shortly because the nerves control it. If the nerves healthy, and then the urine tracts or the urine tubes or bladder and your passage to the outside, and all can be healthy. Okay, thank you very much. Let's look at the anatomy. Okay, this is a picture about the urinary system. So there are two kidneys and the ureter, which is the tubes carry the urine to the bladder, and then outside will be a urethra, which is the passage from the bladder passing the urine out. From this picture we can see the nerves control the internal organ, include the kidney. The lower part of the corner is kidney, and it's partly from the vagus nerves, partly from pelvic area, which is low back, also we call the low back area. So, but the urethra and urina all controlled by the low back area. From this picture we can see, even the sympathetic nerves control the bladder and urina and urethra, and the whole area is controlled by the T11, T12, and L1, L2, and also most nerves come from sacrum area. So if we treat the low back well and make the nerves loose, so because all this tight low back muscle, ligament, tendon can pinch the nerves to internal organ or to ureter and urethra and also bladder area to cause the tight or blocked, and then they can cause the infection of the kidney. So this is my experience. Thank you very much for watching.